Hi, hello guys. Today let's talk about hyperosmolar syndrome. It is another life-threatening complication experienced by diabetic type 2. So yesterday we talked about diabetes ketoacidosis, and we learned that it is also caused by high blood sugar in your body, normally experienced by type 1 diabetes, but also type 2 diabetic can also get it if they're using insulin. So as I said, it's a life-threatening complication of diabetes and it needs urgent attention. So it's usually occur in type 2 diabetes, as I mentioned, and it causes severe dehydration and increased blood concentration, that is high osmolarity. So the common trigger for this condition is infection, such as pneumonia, urinary tract infection, heart condition or heart attack or stroke as well. If you have missed your medication, it can trigger dehydration if you're not taking enough water. And some medication may also trigger this condition, especially those who are taking antihypertensive medication such as diuretic. That's HCTZ. It is a diuretic, so it makes you lose water. And the physiology behind this is that for you uh, to get hydrated is that when you have excessively high blood sugar in your body, the body try to excrete it through urination, and losing water automatically you become dehydrated, and that's why there's a connection between passing urine and also dehydration. So we are also going to see what are some of the signs and symptoms that will indicate that you're having high blood glucose, and which might lead to uh, hyperosmolar syndrome. So sign and symptom: extreme thirst and frequent urination. That is connected because when you are when you're passing your urine, the body signals that you're thirsty and you need to take water. So if you experience such signs and symptoms, you need to understand that your blood glucose is poorly controlled. It's very high. So dry mouth and dry skin. So when you are so much dehydrated, you have a dry mouth, and so you have also dry skin, weakness, and fatigue. So because your glucose is not being used to give you energy, so you become weak and you become so tired. Sometimes you get confused or you become uh, drowsiness also appear. Okay, this might lead to loss of consciousness and can also take you to a coma if you don't get emergency attention. Okay, so the difference between the hyperosmolar syndrome and the DKA is that for hyperosmolar syndrome, it's happen mostly with type 2 diabetes, and the glucose is very high compared to DKA. There's minimal formation of ketones in this condition, unlike in DKA, there's a lot of accumulation of ketones in your blood causing acidity. So that is acidosis as well. So, and DKA mostly happen with the type 1 diabetes, but also type 2 diabetes can experience if they are using insulin. So what you need to do to prevent is to monitor your glucose regularly. And by the way, if you need glucose monitoring, we can talk and can supply to you. Taking medication as prescribed, that can prevent. Taking a lot of water. If you're diabetic, please take a lot of water. Uh, so if you have any infection, you make sure that you're treating it, and also seek urgent care for every sugar or high blood sugar, or when you feel confused. So one thing to take is that hyposmolar syndrome is a life-threatening emergency. Early recognition and hospitalized can save your life. So make sure that you learn about that. Thank you so much, and continue following, share, and If you have any question, don't hesitate to reach out to me. Thank you.